Good morning, everybody. This is Dr. Naina Shah from Manthan. Manthan, who has been running since last 20 years and has started a new series on mental and emotional well-being of children and adults around you. So we also have started a series for some of the disorders which are maybe known to you or may not be known to you but are occurring in day-to-day life. Today's session is on attention deficit disorder, okay, where is which is the fourth session in the series, and we will continue to bring to you different kinds of topics which are of interest to all of you. Now, what is attention deficit? It's generally called ADHD. ADHD is characterized by developmentally inappropriate levels of inattentiveness, impulsivity, and motor activity that appears in at least two or more contexts, that is home and school, and has been present for the last 6 months before the age of 7. So at least before the age of 7, these symptoms should be seen in the child. Now, the incidence of ADHD occurs in almost 3 to 10% of school going children, okay, and which has been observed by the authorities who run the psychological councils, okay. Now, the symptoms of ADHD are number one is inattention. Now, and out of these, at least six have to occur in the individual for it to be really labeled as ADHD. Now, inattention means it fails to give close attention to details and makes careless mistakes. He has trouble paying attention to the tasks that are given to him. He has trouble following verbal instructions, does not follow through an instruction, and fails to finish schoolwork or the work that is given at home, has trouble getting organized, tries to avoid doing things that require a lot of concentration, misplaces things, and is easily distracted by other things around him. Also, this person is quite forgetful. So, if any of these symptoms come, any of these symptoms come, then that person can be really labeled as an ADHD disorder. Another symptom of an ADHD person is hyperactivity. What is hyperactivity? Means he fidgets with his hands and feet and squirms on the seat. He has trouble sitting all the time. He feels restless and jittery all the time. He has trouble in doing things quietly. He is on the go or acts as a driving by motor. He often talks excessively. So these are some of the symptoms which fall under the hyperactivity category of ADHD. Another symptom for the ADHD is that people are very impulsive. So impulsivity acts through before thinking through, gets frustrated even if he has to wait for a long time, and often interrupts the intruders. Now, how to differentiate whether the child is normal or an ADHD, hyperactive or an ADHD? Sometimes we feel that because the child is hyperactive, he falls under the ADHD category. Now, what we have to observe is that the child appears to be in constant motion, fingers, feet tapping, going up and down, climbing, or doing several things at a time, or when playing or watching TV. The child has difficulty in playing quietly, okay, or talks excessively. So these are some of the symptoms of an ADHD child. He has the inability to hold information, okay, in short term memory, impaired organization and planning skills, okay, inability to keep emotions from becoming overpowering, and lack of adaptability. So also, when you observe these in your children, definitely you have to address him, label him as an ADHD child, and do whatever is required. Now, what are the emotional and family problems due to ADHD? Now, effect on family is mothers get the brunt of emotional and physical abuse when the child is hyperactive. Repeated complaints from school and other parents also may put parents to shame and guilt as well, to anger towards the child. Okay, marriages often get stressed because of there is a breaking point, because the couple is not able to handle the hyperactivity of the children. Okay, siblings, the normal siblings also are often victimized by their demanding and bullying behavior of the ADHD child. Now, ADHD child, they're also at risk for psychological problems like depression, somatization, drugs, drug abuse, and feeling lonely. Now, also ADHD children have peer adjustment difficulty. So there is a difficulty in making friends, in cooperating with others, in doing things together with other children. Also, are some of the symptoms of ADHD children. They also are mostly academically underachievers. They cannot perform very well in the school. They cannot score very high. So also, because their attention span is limited, they can do messy work, okay, and also may feel inadequate and lonely because of their qualities of being the ADHD child. They are also prone to accidents because they are careless, they are messy, they don't know what like what to step on or what not to step on. These children also are prone to lot of accidents and self abuse like drugs, alcohol, etc. Now, the positive aspects of ADHD are that at times they are very creative, okay, and they are very highly energetic. So, at times the energy can be utilized in much more productive or meaningful manner. So, they have a lot of stamina, a lot of tolerance, okay, so which can be channelized through games or other activities. Now, the management of ADHD can be multimodal. Combined approaches like medical help and therapy, psychosocial therapy also, are the ways to really manage ADHD. When they have in children, they also require educational inputs along with drug and behavior therapy. So these are the things that are really normally you need to address when you feel that there is an ADHD child with you, and don't say that okay, he's only hyperactive and therefore we don't need to address the problems that are actually happening around him. Okay, thank you a lot. Goodbye, and please do not forget to like our channel and subscribe to it, and we will be back with a new episode on some other topic. Thank you.